Hello, I'm Dr. Brant Gibson, and I'm here to talk to you today about planar warts. Planar warts are a common problem that we're seeing in our office. We see it in both children and adults. Planar warts are commonly seen as bumps or things on the bottom of the foot. They may have black dots in them, which are actually capillaries that are coming to the surface of the skin. Or they can just be a bump that looks like a callus or something else. Once we know that it's a wart, there are a lot of different treatments that people do at home. The most common are topical treatments or over-the-counter freezing treatments and even duct tape. If you search on the internet, there's actually studies that actually show that duct tape will work in treating planar warts. Most of their topical treatments do not. The disadvantage of duct tape is you need to put it on and leave it on for 4 or 5 days at a time, clean the area, then put it back on, and it needs to stay on with multiple applications, of course. It needs to stay on for 3 to 4 months to really solve the problem. It doesn't always work, but it works quite well in people that are able to keep it on. When they go to the doctor's offices, the next thing is commonly to either burn them or freeze them or cut the warts out. Cutting the warts out usually causes a wound that will be there for 2 to 4 weeks and can be problematic as far as walking around and so forth, but it is a way that can treat the current wart. It doesn't fight off the virus, and so the warts will commonly come back. Burning and freezing on the plantar aspect of the foot or the bottom of the foot doesn't work very well because of the thickness of the skin there. It usually fails unless they do a significant burn or significant freezing, which is very traumatic to the area and will cause injury to other tissues. It can also cause warts to appear around the area because you're damaging other tissues. So commonly what we do in our office is we'll actually treat with a special antigen from Candida that you inject into the wart. The advantage is all it does is stimulate your own immune system to fight off the virus that causes the wart. So over a 4 to 6 week period, the warts typically will disappear. The body will fight them off and they will go away. That's our recommended treatment, and we're finding really good results in most individuals from doing this treatment.